The exchange is now getting strange. So far, 37 states are either unable or unwilling to set up those healthcare exchanges required in the president's healthcare law. Now, if the states don't do it, guess what? Uncle Sam will. Dr. Sreedhar Potarazu says this is going to make things even worse. Reason Magazine's Peter Soderman also not a big fan. So, Doctor, you first. What happens now?
Well, what happens now is the federal government has to step in. They've got to fund these exchanges. That amount of money for the government stepping in was not part of the original estimates. We've already doubled the original cost of implementing the ACA. Now the price tag has gone up with only 13 states, and maybe not even, that have said they're going to move forward. And that's really concerning for a debate that we're now having about how to bring the country to deficit neutral. Who's going to pay for this? And of course, this is a contradiction to what the president said before about not establishing a government-run program, because that's exactly where we're headed.
Peter, what were these exchanges supposed to do or ultimately going to do?
Well, look, these exchanges and the rules governing them were set up as a kind of trap for states, because basically states were told, look, you guys have a choice. You can set these exchanges up, or the federal government's going to come in and do it for you. And so, of course, states initially thought, hey, we're going to want to be in charge of our own exchanges. But then they looked at this and said, oh, my goodness, the rules and requirements and regulations surrounding these exchanges are really complicated. This is going to be a huge bureaucratic task. We don't want anything to do with it. We're just going to let the federal government basically handle its own mess.
You know, Doctor, you don't have to be Marcus Welby, I'm dating myself here, to know this looks sick, to know that the government is very much taking over healthcare as we know it, and the very administration of it.
Yeah, and Neil, you and I have had these conversations, you know, for quite some time, and we're in agreement with that they have framed the situation that essentially has, you know, as Peter said, their back up against the wall. There is no way the states are going to be able to get ready or have the wherewithal by open enrollment of October 2013 to have it in place. So what happens? Of course, the government is going to swoop in and say, that's okay, we'll handle this. We'll define the benefits that all of the consumers can buy in the exchanges. And what happens? You reduce competition, you start having costs go up. And do we really believe that the government is going to have the exchanges up in a year? I'm highly skeptical, because if you look again at the progress that the states have made, it's dismal. They haven't put up even the basics of enabling consumers. And so what happens? You've got employers that are sitting on the fence to say, maybe we're not going to provide benefits to our employees and we're going to let them go buy insurance in the exchanges. What exchanges?
What exchanges? Peter, that's the point I want to raise with you, because we are getting more and more of these surprises. The medical device tax that could even affect everything from not only the device you use, but the maintenance of a device is something as simple as a pacemaker. So we're getting these little surprises on a daily basis. We're finding out that now it's 6 million who will likely be paying this penalty versus the 4 million we thought only a couple of weeks ago, and that number could escalate mightily. We're finding out that a lot of small and medium-sized companies are seriously, to the doctor's point, looking at the wisdom of just paying that penalty rather than the far more onerous cost of providing insurance themselves. So this is effectively a government takeover and ultimately a single provider, just as the government wanted.
You know, as we were told, you had to pass the law to find out what was in it. Well, now we are.
Yeah, now we found out, right?
Yeah, so I do want to defend states that are opting out here just a little bit, because what they're doing is they're exercising their rights as states not to put up with federal government strictures. And you know, if they opt out of the exchanges, they opt out of the Medicaid expansion, as the Supreme Court decision this summer allowed them to do, we're going to see, you know, the potential, at least, for little islands of federalism in which some states have decided to opt out of two major components of the law. You know, opting out of the exchanges, opting out of Medicaid, and it's not really clear that the federal government is going to be able to step in and fund exchanges in the states that opt out. So we might actually see states sort of extricate themselves from a lot of the provisions in this law, depending on what they do here.
Well, you know, Doctor, I talked to a lot of doctors, and to a man and woman, they all seem very depressed. Now, that's not only because I never heed their weight advice. That's a whole separate issue. But they don't seem like they're enjoying life as a doctor now. And I wonder how rampant that is.
It's pretty rampant, and here's sort of the byline to that, to what Peter just said. If the states don't expand those exchanges or expand their Medicaid rosters, remember that the hospitals and the doctors working for them were depending upon these new consumers to come in.
That's right.
In order to make up for the money. That's
They
number
gotta
one.
make up. All right,
the
real quick.
second hit was yesterday's Medicare cuts to the hospital. So doctors and hospitals are not happy.